Right now, you're probably doing everything your doctor told you to do. Taking medications, trying physical therapy, maybe even considering injections or even surgery. But here's what nobody's telling you. Those standard treatments often make a bulging disc at L4-5 and L5-S1 worse because they actually cover up your symptoms while ignoring the pressure that is crushing your spinal nerves. Now in this video, you're going to learn how to finally understand what is causing your pain, how to manage those flare-ups without medication, and how to relieve your pressure on your spine using safe, proven decompression techniques. And if you watch until the end, I'm going to reveal the biggest mistake everybody is making during a disc bulge flare-up that actually locks your spine into pain and slows down your recovery. Hey guys, I'm Dr. Tam Ly. I'm a chiropractor here in San Jose, California. Now, after more than 20 years in practice, I've seen so many people wait way too long to get help or just rely on medications to mask their pain. They don't even realize how much they're missing out on life until it's too late. Now that's why I created this channel for people like you living with neck pain, back pain, disc injuries, sciatica, or even neuropathy who are tired of quick fixes and you really want to understand what's going on. Now here you're going to get safe, non-surgical, science-based solutions to relieve your pain, protect your spine, and to restore your mobility so that you can start living your life again, not just going through it. Subscribe now if you want lasting relief, real results, and the freedom to move without fear. I upload a new video every week. If you're watching this, chances are you've been in pain for a long time. Maybe even tried all those medications, all those stretches, and even injections, and you're still waking up in pain and stiff. Maybe you're even dreading those long drives or sitting through that meeting that you really don't want to be in. You've probably been told surgery is your next step. Now, part of you is terrified that that might not work, or even worse, it could leave things permanent. Maybe you've heard of spinal decompression, but your doctor never mentioned it. You're not even sure if maybe it's not legit or just another expensive shot in the dark. So before you give up and commit to surgery, let me show you something that most people never clearly explain: what a disc bulge actually is and why that pain keeps shooting down your leg. If you already know you have a disc bulge at L4-5 and L5-S1, now the real question is, why are you still in pain even after trying everything your doctor recommended? Now here's the uncomfortable truth. Most patients focus on reducing pain, not reducing pressure. Now that's the key difference between getting temporary relief and real recovery. You're in pain because your bulging disc, it's compressing on a spinal nerve like that. Now that compression doesn't just cause back pain, it's the reason why your leg hurts, why you feel the numbness and tingling, and why flare-ups seem to happen out of nowhere. Now the problem isn't inflammation by itself, it's that there's lack of space. When the disc bulges outward, it narrows the exit point where the nerve exits. Now that creates pressure. Pressure creates pain. Medications can dull your symptoms, but they don't change the structure. Stretching or exercises during a flare-up might actually increase that pressure. So unless you're actively decompressing that disc, you're just managing symptoms, not really solving the problem. But that doesn't mean you're stuck. Now there are specific things that you can do during a flare-up to help reduce pressure and help you heal faster without medication. Let me walk you through exactly what to do next. If your first instinct during a flare-up is to lie down, take a painkiller, or avoid all movement, you're not alone. But those habits, while they seem helpful, are often the exact things that keep you in pain longer. When your disc is irritated and pressure is on your nerve, your body responds with inflammation and muscle guarding. Now that's what creates that tight, locked up feeling in your back. Now the key isn't to shut everything down. The key is to calm the system without adding pressure. Now here's what works. First, ice that area, not heat. Ice reduces inflammation and slows down the nerve irritation. Use a thin cloth barrier and apply it for maybe 15 minutes, and you can repeat every hour if needed. Now, second is I want you to support your spine. Use a lumbar support brace for the lower back. That can really help to relieve that pressure and add support for the muscles. Now, third, you can do gentle camel cat stretches, maybe some light back extensions, but better yet, small, short walks. This allows the muscles to relax, promote circulation. Now, the goal isn't to stretch everything out. The goal is to keep your body from locking up so your spine has a chance to decompress naturally. Now, these techniques give your body space and stability it needs to reset. They are simple, safe, and something you can do at home. Now that you know how to take pressure off during a flare-up, let's talk about how to go further and actually decompress your spine for long-lasting relief. Now, if you've tried everything your doctor recommended, such as medications, physical therapy, or even injections, and you're still in pain, you're not alone. Now, most of my patients, they come in frustrated, exhausted, and just ready to give up. Some have, they've already actually scheduled surgery just out of pure desperation, even though they're terrified that it might not work. And I get it, spinal decompression is probably one of those things that you've never been told about. Your doctor never even mentioned it. So it's normal to feel a little unsure if it's safe or if it's even real. Now, let me clear things up. Non-surgical spinal decompression, it is one of the most effective ways to relieve pressure on a bulging disc and a compressed nerve. It's safely done in the office using a specialized decompression table that really just gently stretches and relaxes your spine in very controlled cycles. Now, unlike stretching at home or generic traction units, this system is programmed to target specific disc levels, such as your L4-5 or L5-S1, and it adapts in real time to how your body is responding. So what does that mean for you? Now, it creates negative pressure inside that disc. That helps to retract the bulge slightly, reducing compression on the nerve. And it allows fluids and nutrients to flow back into the disc so it can actually start to heal. Now, most people actually describe this treatment as, very relaxing. Some feel a gentle pull, and others just a light pressure. Now, many report leg pain or tension reduction right after that first session. Now, there's no cutting, no scarring, and more importantly, no hospital stay. And for the majority of people who follow the full decompression protocol, surgery is avoided entirely, not delayed, avoided. Now, if you're wondering why you've never heard about this from your doctor, now it's not because it doesn't work. It's because most of the time your doctors are trained to refer to what insurance will cover. And what is that? Medications, injections, and surgery. But just because it's not covered doesn't mean that it's not effective. In many cases, avoiding surgery, staying active, is far more cost effective over time than dealing with those post-surgical complications and long recovery. So if you feel stuck, skeptical, or scared, that's okay. You're not wrong for asking questions. But the truth is, this treatment has helped thousands of people find relief and avoid the trauma of surgery. And if other treatments haven't worked for you, this might finally be the step that does. Now, let's talk about one mistake almost everyone makes during a flare-up, which actually makes recovery harder, and how to avoid it. Now, if there's one thing that can slow down recovery more than anything else, it's doing this: nothing. When the pain flares up, it's natural to rest, lie still, and just wait for it to pass. But staying completely inactive, sitting or lying down for hours at a time, actually will make things worse. Now, here's why. When you stay in one position all day, especially during a flare-up, your spine will stiffen, your discs will lose hydration, and the muscles guarding your back will stay locked in tension. Now, what that means is that you can have more pressure on your nerves, not less. You might feel some relief in the moment, but long term, your spine becomes less mobile, more compressed, and more prone to repeated flare-ups. What your body actually needs is gentle, consistent movement. Nothing crazy or intense, just the right kind of motion to promote circulation, reducing inflammation and helping your spine to reset. Now, movements like camel cat exercises or supported light back extensions, or even just going for a short walk for 5 to 10 minutes, but remember, only to your tolerance. Now, these things can make a big difference as you are recovering from your disc bulge or herniation. I want you to resist the urge to freeze. That's so important. Controlled movement and mobility exercises are part of the healing process. You now have a clear understanding of what's actually causing your pain, what to do during a flare-up, but more importantly, how spinal decompression can finally get you lasting relief without surgery. Remember, you're not out of options. You just haven't been shown the right path until now. I want you to keep going. Remember, healing is possible. If you found value in this video, like and share it so people living with disc bulges can find hope and clarity just like you did. And if you have a question about an L4-5 or an L5-S1 disc bulge recovery, drop it in the comments below. I read every comment. And if you're considering spinal decompression, look for a certified spinal decompression doctor in your area. If you need help finding one, let me know in the comments and I will do my best to point you in the right direction. Remember to subscribe if you want safe, non-surgical, science-based solutions to relieve pain, protect your spine, and restore your mobility so you can start living your life again, not just going through it. Now, in today's video, I gave you the #1 mistake to avoid during your recovery. But in this next video, I'm going to go over 5 daily habits that are silently making your disc bulge worse and what you should do instead to support real healing. Go watch that video next. It could change everything.